Hi, I am Mai Do. I am an associate professor in the Department of International Health and Sustainable Development. And to me, monitoring and evaluation is a critical skill set that anyone who works in public health should have. Without monitoring and evaluation, you're not going to know if a public health intervention is working, whether it is going to be effective, whether it is worth the investment from the donor, etc. So everyone from the service providers in the field or the clinic to an intervention implementer to a policymakers and donors. Donors also want to know if their investment is worthwhile.
Hi, I'm Dominique Meekers. I'm a professor in the Department of International Health and Sustainable Development. So monitoring programs involves tracking what they're doing, what they're supposed to do. That means figuring out if the intervention are reaching the right people, the people they're supposed to reach. So for example, in an HIV/AIDS prevention program, you want to reach people who are at high risk of contracting HIV/AIDS. So monitoring involves that, seeing if you're reaching the right people, seeing if they are actually exposed to your intervention, are they hearing your communication messages and so forth, and then eventually you need to see if behaviors are changing. That is also monitoring, seeing if there is progress. Impact evaluation is different because it tries to figure out the net impact of your particular project. So typically we assume that things will get better over time because the economies improve, policies change and so forth, but that doesn't mean that your particular intervention did that. It could be a combination of different interventions, different activities, government activities and so forth. So impact evaluation tries to get the net impact of one specific project, holding everything else constant.
You also want to see if your intervention is reaching the right people. Right. So, and how people are reacting to your interventions. So I'm now thinking of a specific example from our project with the Vietnamese immigrants in New Orleans, because I work a lot with Vietnamese immigrants in the US. And we implemented a project a few years ago to promote COVID vaccine among this population, because they tend to have a lower uptake of vaccine compared to many other population groups. And at first we was doing kind of traditional information disseminations. Then we found out from the community, who are our audience, that something like a comic strip, a comic book would be much more relatable to our audience. So we changed our approach there. We partnered with another company and developed a comic strip to promote vaccination among this population using Vietnamese traditional figures, folklore figures that are very relatable to especially the elder generations in the community.
So most of my work focuses on family planning and reproductive health in countries in sub-Saharan Africa. Most of the organizations distribute family planning and reproductive health projects. They might have a network of facilities that provide these services and products, and then typically they do health communication campaigns. And the health communication campaigns can involve a wide variety of things. Typically there are mass media campaigns, radio, television, internet these days, but there could also be small-scale interpersonal communications. That could be peer educators going out to different locations where people meet. It could be somewhat larger interactive sessions. Maybe somebody will go out to a rural area with a mobile video unit, and then people will come and watch the video and they will interact and answer questions at those locations. So that's typically what that involves. In terms of the impact evaluation, then you need to figure out what the net impact is of all these combined health communication activities. When you do mass media, it becomes complicated because there's no comparison group. The mass media will reach the entire country. Radio, television, internet, and so forth. So you don't have a comparison group. Ideally, what you would have is a group that gets the intervention and a comparison group that is similar but that did not get the intervention. So with mass media, that doesn't work. So we have to basically do surveys with a representative sample of the target population, and then use statistical methods to figure out what the net effect is of the intervention.
So the purpose of, one of the purposes of performance evaluation is, as I mentioned before, to see how your program, how your intervention is working, and to serve as suggestions for or recommendations for modifications of the interventions. So another example that comes to mind is an intervention, a project that we did in Ghana a few years back. The project was aimed to prevent young girls from starting to smoke, from smoking initiation at an early age. So at first the implementation was designed, at first the intervention was designed so that it could be implemented as a school-based intervention, so that the information would be distributed to girls at schools in Accra, the capital of Ghana. And so midway through the intervention, we found out that the information was being disseminated in Ghana, but we also found that young girls in other cities also reported being exposed to the interventions. So we asked why, right? What is going on there? And we found out that a lot of girls in Accra were going to boarding schools that had also girls from other cities. So these girls who were in boarding schools from other cities would go back home. And so when you do the survey to see who were exposed to the intervention and who were not, and we found out that there was exposure to the intervention in other cities. So that helped us modify the intervention from the school-based intervention to more community-based interventions.
There is definitely a constant need for monitoring evaluation for all interventions. Obviously, if your intervention has a small budget, that means you can also spend very little money on monitoring and evaluation. So the bigger the intervention gets, the bigger the need there is for impact evaluations and for monitoring, and also the more resources there are. So one thing you will observe is that when programs or interventions are very costly, there is usually a major impact evaluation, because then it becomes really, really important to know what happens with that money.